All right, hello everyone. Thank you so much for joining us here in what will be the final talk in the pavilion for the whole weekend. I know it's been a jam-packed couple of days for everyone, so we appreciate you rallying to come for this session entitled Current Gaps in the Nonprofit Space and How You Can Help to Address Them. We are very lucky to be joined for this talk by Karolina Sarek. Karolina is co-founder and director of programs at Charity Entrepreneurship, where she's responsible for delivering multiple key programs across multiple departments, including mentoring participants in Charity Entrepreneurship's flagship incubation program as they learn to start high-impact charities. Karolina, as if that wasn't enough, is also a fund manager at Effective Altruism's annual Animal Welfare Fund, and a board member and advisor for various EA nonprofits and think tanks. So before I turn it over to Karolina, just a reminder that there will be a Q&A after the talk portion of the session. I'm sure you guys will have tons of questions for Karolina, so go ahead and pull out the Swap Card app now. You can go to this event and click on the live discussion button, and then if you head over to the questions tab, you can ask your questions there or just upvote questions from other audience members, and we'll go roughly in order of which questions are most popular. Please also make sure that your cell phones are on silent while you have those out. So without further ado, please join me in welcoming Karolina.
If you follow the trend line, you'll discover that our lives are getting better. We live longer, healthier, happier lives. The trend can be observed worldwide, and we see it across many, many aspects of our lives. Let's just look at health. So this is inequality of life years in various countries. We can see that inequality of years of life between people in the same country is decreasing. People not only live longer and healthier, but also the gap between the luckiest and the unluckiest one is decreasing over time. Or child mortality. We can see that it's decreasing in all income levels. The trend is changing even more rapidly for those living in low and low middle income countries. Or global burden of disease by age groups, the same trend can be seen here. Everyone from an infant to an elderly is getting healthier. But there are some areas where we see very different trend. This is number of farmed animals alive at any point in time globally. Right now we're reaching about 10 billion farmed animals alive at any point. Despite the trends in human flourishing, we still widely underestimate the danger of disease events such as pandemics and all the progress, or a lot of progress that we made in global health and generally health security can be hampered by one large-scale pandemic. If we look for other aspects of global health, here is number of deaths from smoking in the past and now. So generally, we saw the rate of smoking going down. However, when it comes to number of deaths, this number is still increasing. This is mostly driven by increase in population and aging population in low middle income countries. So even though if high income countries are reducing the smoking consumption because there's so much more people right now living in low and middle income countries, the number of deaths from that are still on the rise. And this is not a trend that is decreasing. So, where there are enormous gaps in the space, it means that there are also enormous opportunities to have impact. And sometimes those gaps, even though they might seem as like very large problems, sometimes the gaps themselves are quite silly that they still exist. And it's quite easy to address them in a large grades of things. So let's take example of lead poisoning. So 2 years ago, the research team at Charity Entrepreneurship identified lead poisoning as a pressing problem that is still under-resourced. This issue has been also researched by GiveWell or Reading Priorities. We've read reports on that. And generally, we can observe that lead is a very highly toxic compound. It not only affects health, but even more importantly, it affects child's development. So if children are exposed to lead, then their cognitive development is going to slow down, and their IQ is going to not rise as much as it could be. Therefore, it's going to affect their income throughout their lives. And if it's happening on a population scale in a whole country, then we can even see the effects on the whole economy. So globally, about 1 million people died because of lead poisoning, and $1 trillion have been lost every year because of that problem. There were, at the time when we were researching the problem, there were only 11 millions going to doing anything with that problem globally. That's not enough compared to the scale of the problem. We recruited Jack and Lucia, two very EA people who met at a conference like this to start lead exposure elimination project called LEAP. Neither Jack or Lucia had much experience in global health or development, or none of them had experience in lobbying or governance. But within 3 months from starting, they were able to convince Malawi Bureau of Standards to ban and enforce usage of leaded paint, which had an effect on the whole country. That work itself affected 15,000 children who no longer will be exposed to toxic lead. When cost effectiveness of their work in Malawi have been estimated, that turned out to be about $14 per dali. Just to give comparison for other interventions in the space, when, for example, we take Give Directly, which until recently have been like a bar for effectiveness as evaluated by GiveWell and other organizations, if we use the same cost effectiveness models, that turned out to be about 836 dollars per dali equivalent saved. So we really see that big gap in cost effectiveness. And of course, we cannot directly evaluate those sort of things just because GiveWell's intervention and Give Directly have been evaluated, had multiple studies on them, and overall they're fantastic, doing fantastic work. Versus the policy organization, which of course has a little bit different rigor that it can be applied to evaluation. Nevertheless, with 60 times the cost effectiveness, we can assume that the effect of that is very large. And this is the sort of things that can be done with very targeted policy interventions. So we can very quickly, as we can see, get from a spot where there's very large gap that very little people are addressing to a spot where progress can be made very, very quickly. Now, LEAP is expanding to 9 countries, and they are doing very similar work in all of those countries that you can see here and planning to scale up further as they go. But there remains many gaps. I will talk very briefly about gaps in animal advocacy, in biosecurity, in global health and development, to outline what could be other opportunities like LEAP that new entrepreneurs could address. So let's start with animal welfare. As I mentioned, the problem is growing. And even though there have been great progress being made in many countries, majority of the animals are still under excruciating conditions. And a lot of that is happening in countries where there's not as many organizations working on those problems. So we see China, we see India, we see Indonesia, we see Bangladesh, Vietnam. Those countries have very little organizations or individuals working on those problems. That's why when we project the number of animals alive now and in the future, we can see that even though we might address many other problems, that's still going to be very likely a problem that we're going to face, and very likely it's going to be as large scale or bigger as it is right now as humanity grows. That's why it's crucial to find interventions that could address that and prevent it from growing or improve welfare of animals in the future, now and in the future. One way to go about that is for international trade regulation. Generally, the problem is that even though we can make progress in many high-income countries on animal welfare, either through corporate outreach campaigns or through government work or public outreach, many gaps still exist in middle and low-income countries, and progress on factory farm animal welfare there is very, very hard. And there are great organizations working on it, but the scale of the problem and how little we know about what works there and how new movement is makes it quite hard for organizations to make progress. One way to address that, though, is for international trade regulations. So the idea broadly here is that countries that have higher welfare standards are still importing products from countries that have lower welfare standards. For example, let's take New Zealand, that is importing about 58% of their poultry meat from Thailand. New Zealand is scored as one of the highest country on World Animal Protection Index that evaluates how the given country protects animals from various abuses. And Thailand is one of the lowest scoring country. So even though it might be very hard to make progress when we actually directly go to Thailand and try to do corporate outreach or government outreach, if only New Zealand started to require the same standards for the products that they're importing from other countries, then that could mean immediate big change for animals living in Thailand. And of course, it's not going to be necessarily very easy. There's the whole World Trade Organization that have to be taken into account, but there have been many exceptions to their agreements, even those based on animal welfare. So we think it's possible to use some of those case studies and precedent to advocate for having that sort of regulations put in place for trade based on farm animal welfare as well. This is one of the areas where I find potentially most promising to have impact in near future on animal welfare in, for example, Southeast Asia. That's why I'm very excited about this organization. Currently, I know that EAG for Animals is doing great work on doing similar things for European Union and trade partners, but there are so many other countries that are still not affected by it, and there's no plan to do that. So an organization that could be started in the space that advocates for that could have enormous counterfactual impact going forward. And not only for the country, but also for the broader context and how that could spill over to other countries. Another idea is banning live bait. This idea that first time was brought up by Solius from Moving Priorities, which I'm very grateful for, because this is an area where I was wrong. When I looked into that in the first place, even though it seemed like a big problem, it looked that the problem is decreasing, and the industries for live bait is decreasing. But over time, after 3 years after that, I was talking with Solius, and he brought very good arguments that this is not the case. We looked into that, our research team looked into that, and in fact, we were wrong, and I'm very excited about that, because now we are a recommended organization that is going to work on banning uses of live bait. In short, the problem is that anglers are using small fish in order to catch bigger fish. And it might not seem like that big of a problem, because how many anglers there could be, how many fish there could be used for that, there are alternatives, and yet in the US alone we can see 1.3 billion bait fish being used for that purposes. So globally that could be around 10 billion. That's a lot of fish. We could probably fill out the whole room with individuals. There is some sign of progress. 8 countries and some states in the US and Canada already have banned it. There's some sign of tractabilities. So I think that if there was an organization that could just push for that, I would expect that progress could be made relatively quickly compared to some of the more complex, harder issues. And yet the impact of that in terms of number of animals helped will be enormous, and will be a very big step forward for animals, not only because of the direct effects, but also the kind of protection of animals in law, which will be important for long term as well. And it's very neglected. I know there have been people who have been thinking about doing that. There have been people who have been thinking about facilitating work on that, but yet nothing like that have happened. So this is a time where we want to really push for that and start an organization that's going to achieve that success. And we hope that the progress of that will be equally fast as the progress that LEAP was making with some other policies issues in other cause areas. And of course, I don't have to say that all of those things look incredibly cost effective. If we just ban that in Ohio, that already will be 80 million fish helped. We cannot see that quick progress on working on some other issues, even related to fish, in such a short, cost-effective manner. So quite excited about that. And sticking to the topic of fish, Southeast Asia as a whole, as a region, and individual countries are some of the largest producers of fish globally. And there's many interventions that could be done that will be very important to improve their welfare, like ensuring good water quality, because for them water is what the air is for us. Lowering stocking densities, not only causing less crowdedness in the pond where they're being farmed, but also potentially that's reducing number of animals that are being produced in total. Disease and parasite management remain also a big problem that an organization could address. And the work is complex, and I'm not gonna lie about that. In 2019, we incubated Fish Welfare Initiative, and I think they're doing amazing work, but also from their experience, we know the environment is very complex, and the farming systems are not centralized, so it's not that we can go to a couple of companies and tell them, do this and that will affect majority of animals. A lot of animals are kept in distributed ponds and distributed systems, so there's not very easy leverage we can have on large scale number of animals. And I feel innovation to some extent is very needed in this space. And more organizations working on those problems independently, because also farming systems and context matters and difference a lot in various countries in Asia, would add a lot of not only the direct work and direct help that can have, that animals can receive, but also the kind of larger impact of finding the leverages, finding the mechanisms for change for animals in such distributed systems and contexts. So what about health security? This is another area we are looking into. And our research team is researching right now what organizations we want to recommend for the next incubation program. But just generally to give you an overview, what are the sort of spaces we look into? So of course, there's kind of the very near-termist health security work, which an example could be vaccination programs. And there's of course long-termist health security. That might be the work on civilization and refugees. We're looking in a space that is in between, neither near-termist that is being addressed by standard global health organizations and other programs, neither necessarily the very long-termist organization and the interventions and approaches. We kind of look in the middle, kind of mid-termist, mid-spot organizations. And there's some overlaps with both of the sides of the graph, but there are some of the more unique ones. So an example could be, for example, pandemic prevention, dual-use research, and regulation of such, improving governance and preparedness for pandemics more generally, or work on antibiotic resistance. And some of those areas overlap, but others might not overlap. So we are looking for interventions that will both have a near-term effect that can be measured, that can be observed, that can be had in a near-term future, but also things that will be very good for the long term as well. And lastly, global health and development policies. With LEAP making a lot of progress quite quickly, we got more optimistic about how much progress can be done in the space and recommended more organizations working on that. One example could be tobacco taxation. Tobacco still kills about 8 million people a year, and there's very strong evidence that tobacco consumption causes harm and taxes reduce such consumption. And that is being seen in many, many countries where such policies have been introduced. So we want to start an organization that's going to advocate for that in countries where such advocacy is currently lacking and there's still lots of people being affected by the problem. And lastly, road traffic safety. This is another one of those very silly gaps that shouldn't exist. So for example, there are countries that have regulation requiring people to wear seatbelts when they're driving a car. The regulations in place, the laws in place, people comply, less people die, that's great. And in the same country, we won't have regulation that a passenger have to wear a seatbelt. So if we're putting law in place that requires the driver to wear the seatbelt, why not to put law that also requires all the passengers in the car? And of course, drivers are always going to be in a car, but we still see a huge number of deaths and lives lost due to car accidents and other vehicle accidents that are happening. And many countries have that part regulation. So in theory, it seems that it will be easier to just add additional, for example, regulation. Not only the driver, but also the passengers have to wear a helmet or wear a seatbelt, and that will be much more tractable than advocating for a new policy altogether, especially that sometimes there are reasons why such regulations are not in place. There's quite strong evidence that even campaigns result in policy change in about 2.6 years. And that's kind of what we can see on average once we reviewed various campaigns. So we believe that when we actually model the expected value of such an organization using those various probabilities, the cost effectiveness of that looks very, very strong. The evidence for that is strong as well. And it seems tractable. So that we are very excited about this organization starting up as well. There's not going to be a specific there's so many other various policy options that the organization could pursue. It could be helmets, could be seatbelts, could be other means of reducing road accidents. There are also many countries, so Egypt, Brazil, Mexico are some of the top. So there's quite a lot of flexibility to adjust to, for example, co-founders fit or the country from where they are from or where they have expertise. So that's an organization we would love to see getting started, and that's another gap that still remains. Okay, so where there's a gap, there's opportunity to have enormous impact. And we think that starting new organizations could do just that. Over the last couple of years, we helped incubate 23 charities up to this point. Starting in 2017, before CE was an organization itself, we supported Fortify Health with incubation, and since then, we've been starting about 5 organizations per year across many cause areas. And if you're wondering about success rate, this is more or less what we see. 2 out of 5 of organizations made progress but remain small or have very unclear cost effectiveness at this point. So they could be very impactful, or they could be impactful right now, and in the future we just still don't know because they may be too small to evaluate them or too small to see the results. 1 out of 5 might shut down within the first 24 months without having significant impact outside of learning or capital and career capital that co-founders have gained. But 2 out of 5 are estimated to either reach or greatly exceed cost effectiveness of the strongest charities in the field. And we are talking about GiveWell top charities or equivalents in their field. And those organizations carries the impact of all of that and all of the organizations. And we can see example of that organization already being on that pathway or reaching that. One example is Fortify Health, the very first organization we supported with incubation. Right now, in the recent evaluation, GiveWell put 25% chance that they're going to become GiveWell top charity. And this is the first organization we ever incubated. So it's very possible that many organizations are on the same path and will reach that level of impact in the future. So Fortify Health, fortified wheat with iron and folic acid and vitamin B12. Not only does it have an effect on health, but also on cognitive development for adults and for children. Fortify Health received 3 GiveWell incubation grants, most recently one for its big scale up, well, $8.2 million, and now they're scaling up, and I think that will set them on a path to having large scale impact as well. Other example for the cost area is Fish Welfare Initiative that I already mentioned. They're incubated in 2019. They were, as I mentioned, they improved working on welfare of farmed fish through collective interventions in India, which means that they both pursue producers outreach, corporate outreach, and governmental outreach, and making progress on all of those domains. They already are estimated to helped 15,000 fish and 1.4 million shrimps, just as a side effects of their work, which is really nice addition. And they have potential for much larger impact because if there is something that I trust them a lot with is the decision making, the impact focus, and the ability to figure out things in very hard and uncertain environment. And given the scale of the problem, they are making really, really good progress on that. Another example could be Training for Good. We are also working in EA Meta, and this is an example of organization in that field. They've been incubated in 2021, and they're providing training and placement into highly promising career paths. So maybe some of you have heard or took part in their programs in journalism, biosecurity policy, EU AI safety policy. They offer training in various those areas and prioritize based on where are the biggest needs, where training can provide lots of value. Okay, so I spoke a little bit about the impact, the sort of impact the organization can have. But of course, that's not of it, not all of that. There's also building career capital benefits for co-founders. What we often see is that when people join an incubation program, at the very end of the program, even if they don't start a charity for various reasons, they often build so much career capital that then have multiple job offers just waiting for them down the line at the end of the program. And also just the fact of starting and running an organization is going to produce lots of generalizable skills that are going to be applicable to many, many other contexts. And the sort of people who start organization, even if it doesn't end up being the top organization in their field, the sort of career capital they build and skills is going to carry that way their impact forever. And lastly, doing good better. And what I mean here is if an organization is being started in the field, not only has the direct effect that their program have, but also to some extent, if they're very effective, they're raising the bar of the whole cause area. So if there's enough organizations that are going to be very, very cost effective, then of course, other organizations in comparison would have to compete more. And we want to build competition based on effectiveness. And of course, collaboration matters a lot within the EA space, and I think that's very important. But also there's lots of ineffective organizations outside of that because there was pressure from both funders and from effective organizations that became an alternative, made those organizations more effective and kind of create that effectiveness pressure, raising the bar of effectiveness across the whole sector. So what are the benefits of the program? I often talk with people who say, I got a very big grant to start an organization, or I have this operational support that helps me start an organization, so it's easier for me right now to focus on other things within the organization. But also the same people tell me, but I don't have a mentor who could help me out, or I got a lot of funding. How do I pay people now? And those sort of things is something that we see everywhere, because we see that there's so many things that could stop person from starting effective organization. And in a way, we have to reduce all of those barriers in order for the organization to fully flourish. That's how we designed the incubation program. So not only help with charity idea, because it's quite rare that a person will come up with the very best idea that exists in a space by themselves. And we have a dedicated research team that researches the best ideas in various cause areas, and later on we recommend them for the program. So you don't have to have an idea. You also don't have to have a co-founder. There's lots of people here in the room who are probably interested in filling out some of those gaps. And I think there's a couple of sessions that helps connect people with each other, but still that's quite a limited pool. And you never know fully who are meeting. You don't know what their skills are, how they compare with yours, and how they fit well together. Whereas with the incubation program, we select from thousands of people to find the very best ones to start new organizations. And those are the people who are in the program. And that's a cohort that enables you to find a person who fits best for you, because you have a guarantee that they're competent, that they're impact focused, that they're entrepreneurial, that they're resourceful and resilient. And now you just have to find a person that you click best with. And that's another big benefit of the program. Of course, there's seed funding that we provide to organization at the end of the incubation program. Last round, it was up to 250K, was the highest seed grant we gave to an organization, and that pool is growing to enable organizations not to worry about fundraising for first year or two, so they can actually start implementing the program and setting up the organization. There's of course a mentorship with mentors from within and outside of the community, specialists and generalists, so anyone that organization could need is available. And lastly, the part that I love the most personally is the community of CE. We often have people who maybe start organization outside of CE just because maybe that falls outside of cause areas that we have recommendations in, or just they've chosen a different pathway. And they often come and just want to become a part of community, because I feel like that's the very big value in itself. So I love that part. And I think that's extremely helpful. And we can see like the level of collaboration between organizations that is, I think, very rare. For example, there was an organization that was hiring for a researcher, and there was absolutely fantastic candidate who applied. It was like very, very obvious that that person would get hired. But there was another organization that also struggled with hiring researchers. And that particular person seemed to have a little bit better background for that. So they just gave that person up. They just passed on to another charity who could even use that person even more and even have great impact. And they found amazing person later on as well. But this is like the level of collaboration that we can see. It's not just fighting for talent, it's sharing talent, it's sharing resources, sharing knowledge. And I think that kind of helps accelerate the whole, not only cohorts, but all the charities that have been started. And the more of them there exist, the more they can support each other. And I think that's like very important part of the work as well. And lastly, 89 Hours in their career profile for founders for new projects tackling top problems says that if you're well suited to this career, it might be the best way for you to have social impact. And I very much agree with that. So who are the people who are best suited to that? Well, the key things that we look for in people is being ambitiously altruistic, a person who focuses on impact, focuses for the right reason, and is extremely ambitious in pursuing that goal. Other aspect that is important is the second part, is the entrepreneurship part. And what that could mean is knowing which things to perfect, which will be very little things, and knowing which majority of the things you just have to do good enough, and knowing what the difference is between those two. Or for example, being able to iterate and pilot and evaluate whether you're going a good pathway and go through kind of a scale-up model. Because usually we might see scaling up as we figure out what's good and we do more of that, and that just linearly scales up. And very often as you scale up, you'll encounter new challenges that will have to be included in your scale-up plan and strategy and changes. So you have to be the sort of person who can come up with an idea, iterate it, implement it in a pilot program, evaluate it very seriously, and then see whether you're going to a good direction. If yes, then it's great, then you scale up. If not, then you kind of go through the cycle again. And that sort of process is going to be true no matter how research the idea is, just because there's always things that desktop research cannot address. And sometimes working on the ground and seeing what is feasible on the ground is going to be a very important factor that's going to dictate that as well. So the sort of person who can do those sort of things. And lastly, I'll outline being resilient. But I don't think it's just about resilience. It's about irrepressibility. What it means is that you not only are not affected if something bad happens, but even if you do, even if there is like a very big thing, an RCT, nuclear RCT can come up showing that this program in that country didn't work at all, or a major vendor pulled out because they changed cause area. There will be sometimes setbacks that are going to be faced by you and your organization. And not being able to bounce back after those with the same level of energy and enthusiasm for the work is going to be very crucial, because even the very best organizations always will have a little bit up and downs. So being irrepressible is like a very crucial part of that as well. And it's not about background. It's not necessarily about experience that people have. We had people started great organizations that were straight from their undergraduate degree in unrelated field, and yet they're running great organization. Or we had very young people without much experience in a given cause area start amazing organizations as well in those fields. So we care much more about the sort of traits that people have and the potential they have, rather than what they already accomplished or what background they already have. And nobody is perfect. In fact, 50% of people who finished the incubation program and started amazing charities did not expect to ever get in. 50%. We would have 50% less charities. Maybe Fortify Health wouldn't exist. Maybe LEAP wouldn't exist. If not for the fact that even though they didn't feel they should apply, even though they felt that they're not good enough or not the right kind of people, they did. And now they're having this amazing work. So don't doubt your potential. Secondly, nobody comes to the program qualified. This is what the program is for. So with the training, we train up with anything that person can need to know in order to start and run an organization. And as you mentioned, the base traits that they're good for charity entrepreneurship is the grit, resilience, intelligence, resourcefulness, focus on impact, and real commitment to make a difference. And for most people, the highest time to start a charity is right now. What if you were able to do it right now, and instead you waited a couple of years to build more career capital or experience, and you come to that place, and you might be in a very similar place as you are right now. That's kind of a couple of years spent on not building an organization, not having that sort of impact. And very often, it's earlier than you think it is. So lastly, all those statements are true. And I absolutely love that short post by our Word in Data. The word is awful. There are so many problems that are still not being addressed. The word is getting much better. And we can see that. And the word can be much better. And I do think that it's not going to happen if we are not going to take actions on that. And sometimes those actions have to be big, and sometimes those actions will have to be very ambitious. And starting new organizations is something that is a way to have like the highest potential counterfactual impact if you're a good fit for that. Because it's very possible that if you don't apply for a job and don't apply for a job, someone else would take it. Very often with those gaps and for new organizations, if you're not going to start it, nobody will, or at least nobody will for many, many years. So the impact that you're having is really, really large. And that's what really could push the word toward that better direction and making it much better. So if that sounds good to you, if any of that resonates with you, even just like a little voice that says like, I don't know if I'm a good fit, but that sounds interesting, let us know. We'd love to talk to you, and we offer career coaching for people interested in entrepreneurship. And it's not always with that we say, oh, you should just apply to the program. We often help people with other careers if it seems that something else might be a good fit for them, or we direct them to other organizations. So we can really help out, and we're here to chat with you. So I have office hours just after the talk, so please talk to me and feel free to reach out at any point. And lastly, if you are ready to apply, please do so. We are opening applications on 29th of September, so in a week from now. And the organization and the gaps I mentioned listed today are the ideas also for organization that we would love to see happen. So we have incubation program in, the next one is in February, March 2023. This is going to be focused on the global health and development policies and animal welfare. And then in summer 2023, we'll be focused on biosecurity and health security. So you can apply to any of those right now. If that sounds interesting to you, feel free to chat to me. And thanks so much. And you have an invitation to join.
Awesome. Thank you so much, Karolina. And just a reminder that we do want to hear questions from you guys, so please do pop up in Swap Card and upvote or add your own questions to the questions tab on the live discussion page. That was really, really cool to hear about. I think charity entrepreneurship is doing some of the most exciting work out there right now. So thank you so much for giving us the inside view. I actually want to start with something that you mentioned towards the very end of your presentation, which is that for a lot of people, the highest impact time to start a charity is right now. I'm sure for many people here, imposter syndrome is very real, and that might not feel like it applies to them, especially if they're a younger person who maybe doesn't have as much work experience. So I wonder if you can tell us a bit about how you can diagnose for yourself, like what stage in your career you're at, and if you do feel like you need to go get experience, do you recommend someone coming out of school, for example, go straight into the nonprofit world? Is it better to go to a bigger corporation and try to learn how efficient, corporate structures run there? Or like, how do you go about choosing where to skill up?
Yeah, definitely. So I'll just start saying that in a way, like it's very easy there. So as you're saying, there are many reasons why people might hold themselves back from it. It could be that in fact they need more experience or they need more training or scaling up, or it could be that it's just like imposter syndrome for them. And in a way, some of the best ways to test it out is try to actually do the thing. And maybe starting the organization is like a very big thing to try if you just want to test your fit. But there are a couple of ways that you can test your fit early on before starting an organization. Part of that, we designed a quiz that you can take to evaluate your fit for the career path. This is a short quiz, and of course, it's a quiz, don't take it too seriously. But we have used that, we designed that based on the experience with entrepreneurs, the research on what makes a good and successful entrepreneur, startup founder, and some of the things that are key aspects of our application process or program to make that a most replicable experience and representative experience of what that could be. And we are not directing you in specific directions, so you're responding the way you actually are, and that helps you. At the end, we give you a little bit of assessment, what might be helpful, and even if you, for example, seem to be a good fit, but maybe need more a little bit background on scaling up, we also recommend resources that might be particularly helpful to you personally, so you can know what the next steps could be in order to prepare. So that could be one thing. And the thing we recommend is just apply. You never know. 50% of people didn't know. And throughout the process, we can also talk and offer you feedback about how you can move forward if that's not the right time. So that is the application process also created not only for us to help find the people, but also for the people to know whether they could be a good fit. So we always keep those two goals in mind when we're designing the system. In terms of like what could be the next step for a person who is considering that, whether that should be consulting, for-profit or nonprofits, I would say that any project that enables you to evaluate how you're dealing with independent projects and responsibility and decision-making in high uncertainty spaces is going to be a helpful thing. So that could take many, many forms. It could be starting for-profit startup, it could be working in very early stage nonprofit where you can see how things are being done, and you're in a sort of role of a generalist that has to do lots of things, similarly to a co-founder. The experience from more established organization, bigger organization, to some extent is helpful as well, just because you learn common practices, but that comes with like its cons and pros. Like you learn some good things, you learn some things that you'll have to unlearn later on, and some of those things will just not apply in that space. So anything that could give you as closer experience to that, either by founding a startup or working in an early stage on nonprofits, is going to be a helpful experience. But even if that's not the path you're on, or not currently you're doing, there are so many other opportunities. Like we often see community builders or chapter leaders be absolutely fantastic charity entrepreneurs as well. So this is the sort of independent project that we are also thinking about that could help prepare people, because you have to navigate and manage people, you have to create strategy, you have to evaluate it, and so on and so forth. So many of things that people see as good ways to build capital would also be good opportunities for that. But I would highlight those couple that we think is particularly valuable.
Nice. Sounds like, no one-size-fits-all profile for who can be a good.
Yeah, although early startups, entrepreneurship, independent projects will be the best things.
That makes sense. One commonality that you might notice among the founders at charity entrepreneurship and just in EA more widely is that a lot of us are from high-income countries. And Akash is noticing that a lot of the charities here seem to work in nations that the founders themselves don't come from. So how do founders build up the cultural knowledge and trust needed to make their projects succeed? Has this been a challenge in the past for CE's organizations?
Yeah, so not all of the co-founders are from high-income countries. Some of them are, for example, in a country where they end up implementing intervention, for example, or at least from the region. But yes, a lot of the founders are from high-income countries. And the way they go about adjusting the intervention or learning about the environment they work in, very often the very first person they hire is a country director, a person who has been working in a country, the person who is from the country, the person who knows the local situation very, very well. And they're in a position of a director of a country where they can help them with the strategy and direct and execute the strategy in a given country. If an organization is thinking on a global scale and thinking about working in many, many countries, it's not going to be possible to, if they're going to plan to work in 10 countries, it wouldn't be possible to have 10 co-founders for an organization. It wouldn't make sense. And often it's the program managers, the directors that will be doing work on the ground that have to have that knowledge and have to have that context. And very often also what happens is the co-founders move, at least one of them, move or spend very significant time in the country where they're implementing the work, and therefore they are on the ground, they know how work works, and they get kind of familiar with the context and situation as well. So I think that's kind of the experience that is very helpful as well, and that's something that we recommend.
That makes sense. Are there any sort of issues that run into, paternalism, for example, people coming from a different cultural context and deciding on behalf of a population that they aren't themselves belonging to, like what would be the right intervention, and any advice about like how to navigate?
So far, none of the charities had problems with that. No one have either criticized them for that or found that. Never it's been a reason why they weren't able to progress in their work. So that just haven't been the factor for them. And maybe that's more unique to their situation for some reason. Maybe it's a fact of hiring people who are from that country that provides them the knowledge so they don't get into, for example, like troubles related to that. So fortunately, so far, that hasn't been a problem. But of course, also co-founders are very conscious of that, and they know where the limitations are, and they know where they have the gaps, and they know that they have to, one of the first person they hire is that sort of person. So I think they are aware of the situation and are cautious about those sort of things.
Makes sense. Luke is wondering, do you have any examples of charity ideas you're really hoping to find founders for right now?
All of them. That's the single most important limiting factor, right? There's idea, there's seed funding, there's mentorship, and it's the person that is lacking. And I would say it might be true across same co-founders across all of the areas that I listed. I guess if I were to list one from the next upcoming program, it might be a person who could be good for the trade, animal welfare focused organization, that sort of skill. This is a space where a little bit more understanding and background in kind of international trade or public policy might be helpful for the organization. So maybe this is the idea where I feel that it might be harder to find co-founders than for others. So that's maybe which I would outline. Nice.
This is perhaps veering a little bit into philosophy, but you mentioned that you have a research team that's coming up with all those ideas for the next most promising charity gaps. And I'm wondering, does charity entrepreneurship take a stance on just how to define what good or harm even is? For an example, like the tobacco intervention that you mentioned, if you ask any individual who's a smoker, they might say, well, I choose this freely, it's relaxing for me, that kind of thing. So in cases where it's not so clear, which side of the coin should win out, do you have a sort of metric or heuristic that you're using to say, we know that this is actually for the greater good?
Mm-hmm. Yeah. So broadly, as many people in the effective altruism movement, generally we look at things from consequentialist perspective, often from utilitarian perspective, but in general we try to look for things that are going to be robust across various approaches when we're talking about the details. I think that's like usually very hard problem and not very tractable problem to address, especially when we are getting into very, very details. Of course, there's lots of frameworks and ways to think about that, but generally we take an approach that would look good at like across many perspectives. But of course, when we're evaluating organizations, we mostly look from kind of like that consequentialist perspective, that utilitarian perspective, and then when there is an organization that might, for example, from one perspective or one ethical framework look very, very good, but like from other framework look like bad or potentially, not harmful, we always take that into account and we always outline that as this is the area where X sort of views would agree with, this is the area where Y view wouldn't agree. So we try to make it at the very least transparent when we think about it and transparent when people are deciding what organization they want to start or invest in or pursue in other ways. With this particular example, I think people are still kind of free to take the choices that they want to make. We're not banning tobacco usage. It's just we're increasing a little bit the price. So people are nudged, but they're not. They're still free to make the choice they're making. And often the effects that we see with tobacco taxation is not necessarily on people who maybe are having the least amount of money to spend on tobacco products, so we're not kind of limiting that, but on people who smoke a lot. So the effect is being seen more on people who consume a lot of tobacco products. So they will be likely continuing that, but just much less and damaging their health less and damaging the health of other people around, less bruising and house smoking reduction as well. We try to outline that when there's disagreements. We broadly pursue kind of consequentialist view, but also try to take into account those other effects.
Makes sense. So you mentioned this consequentialist framework, and obviously an important part of that is being able to measure the impacts that you're having. I know that you mentioned, startup culture and fast feedback loops is a big part of what charity entrepreneurship is about. I'm wondering how you balance that with this notion of measurability bias, that sometimes we can focus too much on finding things that are easily quantifiable and then end up passing on interventions that actually would be really in line with our goals, but are just a little bit harder to pin down. So how do you balance those two?
Yeah, so of course, when we are researching an organization, we look at various methods to evaluate that. So for example, cost effectiveness analysis on number of lives saved or DALYs affected in expectation in the near term is like part of the calculation, and that's part of the things that we take into account. But other things, there are other research methods or perspectives that enables us to take like the longer view and the broader view than that. So it's never going to be that we just look at CEA, this one looks the best, this has like the highest DALY, and that's the organization we're going with. Often that will be other kind of complementary methods that will enable us to also reflect and take into account and evaluate that effects maybe that will be harder to measure. So for example, we try to make the core effects to be high enough to justify high cost effectiveness of an organization. But for example, there are many more. So with Fortify Health, the primary effects are on health, reducing anemia and neural tube defects in adults and children. But it also has effects on mental health that are harder to measure. There is less studies exactly how increased in iron fortification will reduce mental health issues. That's something that's been less studied. There's not very much literature on that. So we'll model in the CEA the effects on health and income, for example, income through those effects as well, for cognitive development as well, but will at the same time list that this is an area where this organization could have additional impact if that's effect that it actually in fact have. There's less literature on that, we are less certain about that, but that's the effects as well. So we usually look for organizations that meet that bar for the measurable effects as well, but often we'll also have organizations that have much impact in that, and that wouldn't be ruled out because of that. And I think like lots of policy interventions will be harder to measure, the effects will be longer, and the attribution might be harder, so that's something that we take into account as well.
That makes sense, yeah, having a sort of a separate bar for the measurable and the unmeasurable is a pragmatic approach, I think. And it always just seems hard to even know where do you draw the line of secondary or even tertiary effects for something like changing the economy and that kind of thing. All right, we have a question from Jacob here, who's wondering, does charity entrepreneurship plan to ever work with Rethink Priorities to find new charity ideas or even whole problem areas?
Live bait is from Solius, so I guess the answer is yes. I mean, of course, when we are creating the initial list of ideas for new organizations, we always start with making very, very long lists, about, I don't know, 400 ideas per cause area or something. And the way we create this list is not only through generating ideas in-house, but also reaching out to organizations that are working in this space that we can trust. And Rethink Priorities is one of those. Open Philanthropy is other, GiveWell, depends on which kind of cause areas we're focusing on. So in terms of sourcing the ideas, we always try to cast a very broad net. And there are some organizations we of course put more trust in versus less, and Rethink is one of that we put trust in as well. And as you can see from LiveBait example, that's something that originally had been crafted by Solius when he's still researching on Rethink. So I think there's a space for more work like this, just because there's lots of problems, there's lots of ways to evaluate them, and we also think that any research organization that's going to make progress on either researching new cause areas or interventions within cause areas, this is something that we'll always have our eyes open and we'll be integrating into the system and potentially recommending as well.
Speaking of this example of LiveBait, you mentioned that that's a thing that you changed your mind on. You thought at first it was not promising and then updated based on evidence, which we'd love to see. I'm curious, are there any other things that you have been wrong about, not necessarily in the particular cause area, but even just in starting charity entrepreneurship yourself? What are some of the mistakes that you've made that you've learned the most from?
I guess the thing that I mentioned a little bit about, or also the thing that you asked a question about, is the kind of measurable effects. Maybe that's something that I've been changing my mind on, is sometimes we work in a space with very little evidence or comparatively to what we would like to see. And in the past, I thought that even though those spaces have little evidence and it might be harder to make progress, we should still be aiming having immediate, maybe not immediate, but very quick results that we can see in the direct metrics, like number of fish helped or number of shrimp helped or something like this. And I think in the past I've been maybe neglecting kind of the longer strategic view and importance of that. For example, importance of learning and how much expertise on the ground needs to be built up before the best iteration of intervention is going to be developed. So even though I would love to just figure out the best idea sitting behind my laptop in London, I know that there's, especially in low evidence spaces, that's going to be very, very hard to do. And often there's a direction we can research, a problem we can compare, intervention that we think is good, that we'll recommend, that we'll research, but an organization that is on the ground would have to have that ideation and evaluation piloting space because there will be so many other things that they will learn on the ground that otherwise, even if someone came to the country, worked with the same people, it's going to be a very different situation if external researchers coming and trying to figure it out versus if there's organization actually trying to do the thing, because very often those things they wouldn't otherwise bump into. So the importance of that learning and that sometimes impact is not going to be achieved in the next few years from starting, but rather that will have to be a little bit of a learning process. And I think that longer perspective, sometimes strategic importance of a given organizations in space have been something that I've been putting more weight on since starting up.
Nice. That seems like a good change that's worth moving towards. Given how hard it is to sit behind a laptop in London and figure out...
It's fun. I love that. I don't think it's hard. It's great.
it seems at least the success rate you guys have had is just crazy. 2/5 of charities coming out and having a measurable positive impact just strikes me as bonkers. So how do you explain, given how competitive startups in general are and how the vast majority of them fail, what's responsible for that high rate of success? Is it just people aren't even jumping in unless they have a great idea in the first place, or is it really the community that's pulling together?
Yeah, so I think that often how it works with startup incubation is that there's a co-founder who is a good fit for that, and they have an idea. And often, they might have an edge that enables them to find an idea that otherwise wouldn't be found, and that's great startup is going to do succeed very well. But very often those ideas are not that good, or they need a lot of work. And that's probably part of the reason why that contributes to startups are not working out, is just the idea itself part of that. That's why kind of we had the research team to research the space, to find the gaps and find the ideas that if implemented well, is going to have a very high impact. So this is that part of that of the situation. The most common reason why for-profit startups fail, from the literature that we've seen, is co-founders' disagreements and conflict, and that's the single most important reason why startups fail. And that's something that we care a lot about during the program as well. So first of all, selecting a cohort of people that join the incubation program to really make sure that they're aligned with the values, they're competent, and all of those things, focus on the right things, but also put a lot of attention to co-founder pairing. So co-founder pairing is not something that just happens on one day, just before they have to be put together and submit an application for a seed grant or something like this. It happens throughout the whole program. So not only the co-founders are selected, but the way co-founder pairing works is throughout the process, we have projects that co-founders work with each other. They start with working with everyone in their prospective cause area, and over time, they work on longer and longer projects with fewer and fewer number of people. So after each project, we ask them for feedback. How was it working with this person? How did you feel with that? How do you feel that your skills complement? Where did you have disagreements? Where did you felt that you're misaligned? Do you think that's something that's workable? We do like a short survey after each project. And based on that, and based on things that we know from the other co-founders and people in the cohort, we suggest a co-founder pairing. And the next project they do is much longer than the previous one, with fewer number of people that seem to be better fit. And that happens throughout 2 months program. So at the end of that, they actually have pretty good sense of, they already know the person, they know who they worked well with, and additionally, we give them to do some sort of, something we call like co-founder agreement, where they not only outline how they're gonna split responsibility. You're gonna be the communication person, you're gonna be operation person, but also talk about values, epistemology, like how you're gonna make decision, how you're gonna approach these situations, and actually let them agree on those things ahead of time to make sure that they're on the same page. Very often what happens with startups is that there will be elephant in the room, but they'll just like leave it for now because they're building things and they're busy, and it's going well, and there's this like lurking thing that might blow up in the future. We try to get this part out of the way from very beginning, so they are really with the right person. And I think that helps a lot with the startups to be able to make that progress.
Makes sense. Sounds like the most wholesome version of The Bachelor ever.
Yeah.
Long matching process. And the results speak for themselves. So thank you so much for the work that you're doing and for spending your valuable time with us today. Please join me one more time in thanking Karolina.
Thank you very much.
Yeah.